Okay, hello and welcome to this first in a series of radiation oncology resident roundtables. I'm Dr. Emma Fields, and I'm a radiation oncologist. I'm the program director at VCU, or Virginia Commonwealth University in Richmond, Virginia. I'm the immediate past president of ADROP, which is the Association for Program Directors of Radiation Oncology Programs, and I will be moderating today's discussion. So the purpose of this webinar is really just to let you as medical students learn more about radiation oncology and hear directly from some of our current residents about how they got into the field, what their day-to-day experiences are like, and what they look forward to in their radiation oncology careers. Next slide. The agenda for today will be to meet and hear from 4 current radiation oncology residents who I will let introduce themselves in just a moment. The panelists will answer common questions that medical students have and likely questions they've asked themselves as they were choosing a specialty. We'll then share some resources that you can access to help you learn about the field of radiation oncology. And we'll close out with contact information for all of us. So if you want to reach out to us at any time, please just do so. Okay, let's meet our panel. First off, we have Dr. Amishi Bajaj.
Hi. My name is Amishi Bajaj. I'm a PGY4 resident in radiation oncology at Northwestern in Chicago. And I went to the Chicago Medical School at Rosalind Franklin for medical school. I first became interested in radiation oncology after attending a tumor board during my internal medicine and surgery rotations as a third-year med student. And I was drawn to the field because it offered diversity of pathology with also the depth of subspecialty expertise, which I thought was very unique for this subspecialty. So that was my main draw. It's nice to meet everyone.
Great, thank you. Next, Dr. Dakeem Gaines.
So I am also a 4th-year resident at, at Vanderbilt University in Nashville. I went to medical school at Robert Wood Johnson, Rutgers in Central New Jersey. And I think I first became interested in radiation oncology pretty early on, actually before medical school. I did some research as an undergrad in the radiation biology lab. When I started medical school, I at least had some knowledge of the specialty. And when I finally did some rotations in the specialty, I became instantly interested in the way we treat cancer. It's very different than other specialties of medicine. And then that, the ability and the privilege to work with cancer patients has been very exciting as well.
Great, couldn't agree more. Okay, next, Dr. Bailey Nelson.
Hi, everyone. I'm a 4th-year resident at the University of Cincinnati. I also went to medical school at the University of Louisville. I think my favorite thing about the field of radiation oncology is our days never feel monotonous. So in one day, we could be involved with treatment planning, tumor boards. We could see patients during consultation or follow-ups, or see patients during their on-treat visits. So happy to be here with you all today.
That's so true. It doesn't even include brachytherapy and all the other cool things that we do on a day-to-day basis. Great. And then last but not least, Dr. Gabe Vidal.
Hey everyone, Gabe Vidal here. I'm currently a PGY4 chief resident at the University of Oklahoma. And so I also went to medical school at the University of Oklahoma, where I did my internal medicine residency. I always knew I wanted to do oncology from undergraduate, but my road to radiation oncology, I would say, was a little bit different. So initially, I got exposed to medical oncology in medical school and pursued internal medicine with the goal of doing medical oncology fellowship. The interesting thing was I was a senior resident on an inpatient team, and I referred a few patients to radiation oncology, and I really wondered, like, what's going on in there? What's going on in this black box in the basement at the cancer center? And so I kind of, went over to the cancer center. I wanted to see how my patients were being treated from the hospital. And I was able to observe how they were being treated, what was going on. And I realized, wow, these doctors are actually, seeing my patients, taking care of my patients. And the misconception that I had was that radiation oncologists were more so on a technical level, where they're mainly handling images and coming up with plans and not necessarily spending that much time with the patients. And so that experience alone was really changing for me. And so I had the opportunity to switch over to radiation. So I finished internal medicine and currently at PGY4 in Oklahoma. And I'm glad I switched. It's been great.
You're PGY like 8 or 9.
Yes, 7.5.
7.5. Okay, good. Well, that is a great intro to our first question. And actually, Gabe, if you can answer for us, now that you've seen sort of both sides of it, can you describe to us what is your typical day like in your RadOnc residency?
Absolutely. And so we show up for checkout at 5 o'clock in the morning. Just kidding. Those were the medicine days.
No, and don't turn off the video.
Right. Please stay with us. Stay with me. And so it varies based on the service, but typically clinic will start around 8 to 8:30. You may have a couple of consults in the morning that you're going to go see. The really nice thing about our specialty, you have enough time to spend with your patients. Being in primary care, I would have 30 minutes for a new patient visit, which felt hurried and rushed at times. And so with us, first of all, you have reviewed the case already. So you know the patient from a chart standpoint, but then you're able to sit with them, talk to them. We typically have about an hour to an hour and a half to really go through, first where they are versus, the treatment that you're going to offer. And oftentimes I hear in clinic, thank you so much for taking the time to break down these concepts. Like I never really understood what was going on, or there was so much that I finally get a handle on what's happening to me and the treatment. So our patients do appreciate that time. And I enjoy having that much time with each patient. And so in between patients, you may be reviewing a plan or finishing contours. Clinic is very, for us, it's systems-based. So you may be treating a couple of pathologies. So you could be seeing a breast consult in the morning and then approving a breast plan in the afternoon. But overall, the hours are very manageable, typically 8 to 5, sometimes 8 to 4, 8 to 6. It just depends on what you have going on at home also. So I have 2 kids and clinic schedule is very manageable to be home with the kids. And so sometimes I'll even get off early to do something with the kids. And then I'm able to work from home even to complete the work.
Yeah, you're exactly right. I'm the same. I have 2 small children, and balancing is definitely something you can do in this specialty. Now, I know that rotations can work a little bit differently in different programs, but Dakeem, will you tell us a little bit how they work for you and maybe sort of a general overview?
Yeah, this is a great question. And I think, like you said, it can vary depending on the residency program, but generally it's a few weeks by disease site. So here at Vanderbilt, we do 8-week rotations. So we found that gives people the opportunity to do the same disease site multiple times. So what I mean by disease site is we'll have a breast rotation where you work with the breast attending and see patients with breast cancer in consultation and design those treatment plans. And then you'll switch to a head and neck rotation, and then a genitourinary rotation and a gyne rotation. So it really gives you a lot of depth and variety to see all the different types of cancer patients and even some benign patients that we treat through radiation oncology.
That's a great overview. And you mentioned you kind of get to do the rotation twice, so you become a bit more experienced working in these teams. But in addition to sort of that day-to-day teamwork aspect, Amishi, can you talk about any of the leadership activities or opportunities that you found in RadOnc residency?
Yeah, I'm happy to. So all 4 of us on this panel right now represent the junior class for ASTRO, which is the Association of Residents in Radiation Oncology. And ASTRO is a great way to get involved in leadership in radiation oncology. We are part of the executive committee, but in addition to being on the executive committee, there are also options to serve on a subcommittee. So we each, chair 4 committees, of which one is global health, which is Dakeem. I represent communications. Equity and inclusion is Gabe, and education is Bailey. And so there are options for getting involved with medical education through joining the education subcommittee, with communications among different organizations on my subcommittee, global communication with DKIM, and with getting involved with equity and inclusion initiatives with, Gabe's subcommittee. So those are all great avenues for getting involved with leadership. There's also the option for getting involved with leadership at the institutional level as well. So within my department, I serve on our QA committee, which is responsible for quality assurance metrics in our department. I'm also the president of the House Staff Association at Northwestern, which has been a really nice way to get to know residents and other programs as well, which gives a unique, multidisciplinary perspective and such. So there are, in addition to ARROW, there are other organizations too, like the American College of Radiation Oncology and all sorts of other opportunities. So I would definitely recommend it. It's a great way to meet people, get to know others. We all kind of go through the same thing, network, et cetera.
Yeah, I think you're right. There's lots of opportunities, and gosh, the more our specialty evolves, the more people in leadership positions want to hear from the residents to make sure that our specialty is moving in the right direction, because you guys are the face of the future for radiation oncology. Speaking of, kind of networking and getting to know other residents, I know the rotations that DKIM spoke about are really one-on-one in an apprenticeship model with the attendings. So do you feel like you're isolated, or do you get to know your other co-residents, residents in other programs? How does that work? I think, Amishi, you were going to take that one.
Oh yeah, definitely not isolated at all, in spite of what it might seem like from the one-to-one apprentice model. I would say radiation oncology residency, at least in my purview, is very socially rich. We spend a lot of time in our resident room, as residents, and it's actually fantastic. I feel like it's really important to communicate with your co-residents as a supplement to education, because we often talk about, the patients we see, even when we're off service. I feel like I'm still learning about other disease sites through my co-residents. We talk about data together. We critically analyze patient care together. We talk about how our practice is going to vary from what we're seeing, because that's really important too, not to just treat rotely from what you learn in training, but to actually cultivate an autonomic or, autonomy kind of sense of self, and, really go forth and decide, what am I going to do as a clinician once I enter the workforce? So it's the exact opposite. In spite of the one-to-one apprentice model, we communicate frequently. We see each other at didactics. All residencies are, pretty closely knit and have their own social functions. So it's a lot of fun, actually.
It is. My co-residents from now, gosh, 9 years ago are still some of my best friends. So I completely get it.
Yeah.
Now, this next question is really a hot topic, so I'm going to kind of get all of your perspectives here. There's been a lot said about the job market. So what have you seen from your experience with your senior residents or other people you know in other situations? Is it hard to find a job? Let's start with Bailey.
Yeah, so over the years, I've watched my chief residents go through the job hunt. And I will say that all of them have been very pleased with the jobs that they've gotten. I think something that's unique to our program is a lot of people actually want to stay in the region, and everyone has been able to the past at least 3 years. So I think from that perspective, I think that my co-residents do a great job. That's
great. Definitely encouraging. What about you, Gabe? What's been your experience?
And so, I'm currently a PGY4. I'm starting to look and stay in touch with the people who are applying. And so far, what I've heard is that people are able to find jobs, in the areas that they want to go. But coming from an internal medicine background, it's a little bit different, I would say. So the field is smaller than internal medicine. I still receive emails from recruiters from internal medicine, like, hey, do you want to come work here? So I would say the job market for a hospitalist, which is what I used to do before RadOnc, is much wider, much more flexible than for RadOnc. But at the same time, I feel like, there are offers out there, I'm in Oklahoma, and I feel like that's an easy sell. I want to stay in Oklahoma, so it's an easy place to look at. But at the same time, I have heard of offers like on the coasts, and I've been contacted by people like, hey, are you looking? Are you interested? And so I feel like overall, the job market is healthy. It's not as easy as some specialties. And I think we have to be mindful of that as you're considering radiation, especially if you have a partner who's also in medicine or another profession that could potentially restrict your choices.
That's a good point. It's not always just your decision.
Right.
Great. Dakeem, what's been your experience?
I feel like the job market, you hear kind of these negative things online or, through the grapevine sometimes that there's no jobs in radiation oncology. I've honestly experienced the exact opposite. I'm speaking anecdotally. My 3 years of being at Vanderbilt, I have not noticed any senior residents have to struggle to get a job. We're now in January. Currently, all three senior residents at Vanderbilt all have signed contracts at their top choice. We have two going to stand in academia and one going to private practice, and then that's what they wanted to do, and didn't have really any difficulty there. And that's kind of what I hear from my friends as well at other programs. So I think the job market's good. I'm very optimistic we're all going to enter that next year. But I think just getting a good advice from people who've gone through it is probably more important than some of the hearsay that you may find online.
Yeah, using your resources too, asking your faculty for connections. Our senior residents have the same experience. They both have jobs. And in fact, one of ours is coming to you at Vanderbilt,
That's right.
Which is very cool.
We're excited to
Okay,
have them.
Amishi, what about you? What are your thoughts?
That's really exciting. I agree with everything that everybody else said. There are a lot of limitations that can be, kind of important to consider from a partner, from personal preference. What are you looking for in the job? So it's not just about finding a job too. I think that people often come at this from a perspective of there are no jobs, but the real thing is there are no jobs that they are particularly looking for when they say that. And anecdotally at Northwestern, I think our placement has been wonderful. Everyone has definitely not only found a job, but found a job that they're very interested in, like a highly coveted position. So that's very reassuring from a personal standpoint, because as always, I always look up to my senior residents for advice going through the whole process. So this is no different, right? The ultimate goal of securing long-term employment. I think, we don't really know about jobs unless we actually have data that's concrete. And that way, it's really important for us to have these surveys that we have. So ARROW is responsible for this graduating senior resident survey, which talks about jobs and job placement and looks at metrics like desirability. And we just, we're in the process of publishing our results, but we just presented our results at the most recent ASTRO meeting, and they were quite favorable, which is really encouraging. So that's something that we can all keep working on too, is, accumulating a robust, database that kind of describes, how people feel about their jobs. So.
Yeah, that's really true. Those surveys are definitely encouraging, and ASTRO is putting a lot of effort into this as well. I'm actually part of the workforce task group. And so there's going to be a really deep dive into sort of the whole supply and demand, which will hopefully, reassure us and at least answer these questions. But I would say, back when I was applying in 2013, the same things were in the grapevine about there not being any jobs. And I spoke to my chairman, who I won't say how old he is, but went through quite some time before me. And he really said, that's always been what people say. It's hard to get a job when you've been used to sort of going through the transitions from college to med school to residency, kind of putting yourself out there, being vulnerable. It's just a different experience. But I agree. I don't think the outlook is really negative at all, but certainly not negative like you hear or read on some of the online platforms that we'll talk about here in a few minutes. Good. Well, thank you all. So the next question I'd also like to hear from you all, just hearing about program rank lists. So there's lots of diversity in the programs, right? There's large programs, small programs, different parts of the country, and there's some ranking systems. How do you kind of make sense of how you rate programs when you're looking at them? This time, do you want to start, Dakeem?
Sure. So this is a great question. I think the rank list is very personal. It's kind of what you value and what you you want to get out of your residency training. So if, big name brand kind of places is something that you highly value, then that's how you should design your rank list. And wherever you get interviews at kind of these type of programs, those are the ones that I would put first. But ultimately, it comes down to a personal feel. When I was interviewing at places, it was all about feel. Like, did I feel like I was going to fit in at that program? Did I feel like their teaching style was aligned with the way that I learn? And that's ultimately how I design my list. So I will just say quickly that I almost didn't even apply to Vanderbilt. Coming from the Northeast, kind of just never lived in the South at all. So I was a little nervous about taking it down to Nashville. But after coming, like I said, interviewing here, it was the best feel. And I ended up ranking it at the top of my list. So
you got cowboy boots on?
Nope, I refuse to wear.
Yeah, it's definitely a personal choice and all about feel. It's really tricky now, right, with all these virtual interviews. I don't know if y'all have some advice for people who are having to make rank lists without visiting. Bailey, do you have thoughts on that?
I know that that's something that's been really difficult. I actually was a part of our interviews this year, and it is hard to get a feel for a department if you're not actually able to visit. But I think the important thing was trying to get to know the residents and the faculty over the virtual interviews, which is difficult, and just asking them the hard questions and making sure that they are happy where they are. But I do not envy the medical students that are interviewing this year and last year, because I did really love traveling to the different locations. And I think it is okay to reach out to the residents after interviews if you have any lingering questions as well.
Yeah, the residents are a great source of information. They really have nothing to lose by telling you the truth. So that's a really important point. And you have to work harder. You have to ask those hard questions when you don't get to be there in person. Great. Gabe, what do you think?
So I feel like Zoom, and the virtual interviews are definitely a challenge. What I would recommend, especially if you're looking at a different city, is maybe networking within your medical school class and figuring out, okay, who else has interviewed in that state or in that area, and what are your feelings about, that campus or that city or that program. So maybe you've got some friends who are interviewing for surgery or internal medicine. So reaching out to them to get a feel for the location, because you will be training at that place for 5 years. And so it's a decision that, it's going to take a while. You're going to be there for a while. You want to make sure that it's a good fit for you. If you have a family, then also talking to your family, trying to figure out if that makes sense. I know that some programs are like offering either a virtual tour or like in-person tour, or even if you have a chance to just go to that city to figure out, is this a good fit? Like, you don't have to go on the official, interview, but if it's not that far, I would recommend you at least taking a drive out there, being safe, being careful during the pandemic, but definitely taking a look and getting a feel for the city beyond the program even.
Yeah, that's great advice. What went into your rank list decision, Amishi?
I think this is a great question. And as we discussed, it's really personal. For me, I ranked programs based on how happy I felt I would be there. And that for me was really important, because I've always found that when I am at my happiest, I'm my most productive self. I study the most, I do the most, manuscript writing and, actually finishing them and such. So when I'm happy, I'm, really good to go. And that really came down to relationships for me. I think relationships are really critical in residency. With the one-to-one apprentice model, you work so closely with one attending for 2 months that it's almost like being in like a short-term relationship. Like by the time you're done with that rotation, I've often adopted the lexicon of my attendings. Like if they have like odd idiosyncrasies, like I have picked those up and incorporated them into my own behavior. Like that's how much time you spend with this one person. And that was so critical to me, because if I were to be on the receiving end of microaggressions or, even sometimes like blunt statements like that, I'm a deeply sensitive person. And I think that would bother me enough that I would feel like more concerned about how I'm being perceived and, how I'm like, not doing as well as I could be, rather than focusing on the really important thing, which is becoming a very strong radiation oncologist. And I just wanted to be in a program where I was, respected and valued for my contributions and like treated, essentially as a colleague, which is something I'm really thrilled about my department, is everyone's like wonderfully kind and easy to get along with and work with. And it just makes for such a not just collegial atmosphere, but like familial, to the point where I just feel so comfortable being at work. And I really feel like I'm my best self that way. So.
Oh, that's fantastic. Yeah, those relationships are so key. And RadOnc is kind of like a big family.
I think so. Yeah.
lots of nice people in our specialty for sure. One of the things that certainly intimidated me when I was looking to radiation oncology was the worry about having to know physics and radiation biology. Now, medical students hear about having to take all these board exams. Can you explain how the board exams work, Bailey? How many, when, and what they are?
Yeah, so we have 4 board exams. We have radiation biology, physics, clinical writtens, and oral boards. Historically, residents would take physics and radiation biology together after their PGY 4 year, but there was a recent change and we're now eligible to take rad bio and physics after PGY 3. You can take them together or you can split them up and take one at a time, which is what I did. I felt it was more manageable that way. So I actually took physics after my PGY 3 year, and I'll be taking rad bio after my PGY 4 year. And then we take our clinical writtens at the end of PGY 5. And I think probably the most intimidating board exam is probably oral boards, which you take your first year out of residency when you're in attending. But just to put in a little plug for the ASTRO Education Committee, we actually have great resources available for board prep that we're excited about.
Oh, that's awesome. And those are all new. I wish I had have had them for sure. But, it's funny now being on this side of it, you realize that all of those board exams are just to, again, make us the best we can be. The whole purpose is to pass you through and just catch anything that you could be doing, to harm somebody. So most people, overwhelming majority, pass all of those boards, which is great. Excellent. So another thing that medical students often hear about is the need for a lot of research on their application. Some even consider taking a year off during medical school to be competitive in the application cycle. Now, I know, Dakim, you are definitely really into research. How did that work for you, and what's your perspective there?
For me, it was a little different. I did a combined MD PhD program, so I took 4 years off, if you want to
Not
put
really
it that
off,
way.
though.
But I don't think it's necessary. I think programs want, just speaking generally, I think programs want a diverse class. So people who are interested in research, people who are more clinically minded. So I don't think it's something that's 100% necessary. I don't think having research on your application at all hurts you. I think it can only help you, but I don't think it's a requirement to match into radiation oncology. I think if you hate doing research, I would say to spend your time doing something that you enjoy and showing, maybe gaining more clinical experience in radiation oncology and being able to talk about that experience during interviews is much more important and authentic than doing some research project that you hate. So
gosh, as a program director, I couldn't agree more. Just showing that you have initiative and interest, whether that's primarily clinical or through research, and that you can talk about what you've done and what you're interested in. I think that's brilliant. So insightful. Well, gosh, the last 3 years have been quite challenging with the match. So I guess we'll just ask it straight up. Amishi, what's up with the match?
What is up with the match indeed? It's been, as you said, the last few years have been really different. Back when I was applying to radiation oncology, or we all, were, because we're all in the same year, it was considered like a, highly competitive, like I might not match kind of field. Like, that was a genuine thing. Like I met with my medical student clerkship advisor, and, bearing in mind that I came from a medical school that didn't have its own radiation oncology program, they insisted that I should actually like dual apply to something like internal medicine. Like that was just to kind of illustrate, how concerning it was to them that like their medical student might not match into a radiation oncology residency. And the landscape has certainly changed quite drastically. Why that is, one can speculate. And I think, medical students are really the ones who have the answers to that question because they're the ones who are applying. In hindsight, we feel differently, of course, but I think we as ASTRO, we represent ASTRO in the junior class on this panel. ASTRO itself as an organization has published about the match. There's a publication that came out last year by Goodman et al. Basically, it's called No Longer a Match and talks about how, in addition to there being a decrease in the number of medical students applying to radiation oncology, a lot of the pre-existing spots are now being filled through the supplemental offering program or SOAP. And, it basically talks about, that publication talks about how this does not allow for what might be necessary market correction, but also takes advantage of kind of a more vulnerable, student who might be in the position of having no residency at all versus at least going into radiation oncology, whether they're interested or not. And, it's a pretty niche field. It's unique, for sure. We talked about it already. There's radiation biology, there's physics, there's, a whole breadth of different disease sites. And, the training is substantial. It's, 5 years. So there are a lot of different considerations and the student is forced to make that choice very quickly. And, for the next, that's their whole career. It's not just 4 more years after an intern year. It's a whole career after that. So, the match it's interesting to see kind of why that is, but there are some really strong supportive program directors like yourself, Dr. Fields, who are, encouraging in their desire to not fill through SOAP and to kind of maintain the integrity of the interest of radiation oncology and making sure that students are making an informed choice when they choose our field.
Yeah, I think you're right. Having people in the specialty that don't want to be here is not going to be good for anybody. And if there really is a problem with the job market, people who, don't want to do radiation oncology, and then goodness, if they can't get a job, we're going to have an exponentially just huger problem. So yeah, I agree. I think just keeping people interested in radiation oncology and bringing them into the specialty. And, we'll figure out what is the deal with the supply and demand. But as we mentioned, there are great jobs and people in the specialty are very happy. So good. Speaking of the job market and the match, there's a lot of information out there, and medical students often use these resources because they're so easily available. So what do you guys think about the Student Doctor Network and Reddit? Jakeem?
These are, as most medical students know, I took a peek as a medical student as well at these, and I just felt like they were always negative. They never, in any specialty, you have this anonymous forum where anyone from anywhere can post kind of whatever they want. And I think, there is probably some advantages to that because people don't have to, worry about, consequences of their statements. But with that being said, there's just a lot of false information. There's a lot of, he said, she said, without any factual basis to it. And I think if you, as a medical student, if you look at it, taking everything as a grain of salt, I think you find that it's much more useful to just talk to people that have been through this process and that are in this field.
Sure, some of it might be true, but it's hard to tease out. Not very reliable. Gabe, what do you think?
I agree with you all. I feel like it's a resource out there. And interesting enough about radiation oncology is, if you all haven't noticed yet, we're all about our trials and looking at the data and looking at the evidence. And so I would recommend the same approach to SDN. I feel like there's some information that could be helpful, but taking a critical appraisal of SDN, so to speak, and going through it and realizing that, like Jakeem said, it's an anonymous website where the majority of people are not really posting their real identity. So it's almost like a vent fest where people are just venting their frustrations in regards to the field or the job market. And so it's very unilateral, I would say. But so as you look through it, I'll confess, I looked through it, you know, when I was doing internal medicine, when I was looking at medical oncology, when I was looking at radiation oncology. And despite all of that, I still went into RadOnc because I just felt like it was a good fit for me. And it was a field that I really liked. And so despite all of those comments, you know, I'll be honest, I had some doubts reading through the website and it made me question. But at the same time, I was like, you know, this is one aspect and this is somebody's personal opinion and they're not even coming forward with their own identity. Versus what I saw in the clinic versus the patient interactions that I had in the clinic and talking to senior residents who were getting jobs or getting placements. Maybe it wasn't at their top choice, but again, this is an entry-level position that they're looking at. And so, you know, I took all of that into account when I made my decision to switch. And some people are like, you're crazy. You could have done, you know, medical oncology a lot more flexible or had a job as a hospitalist 7 on, 7 off, and you still chose to do that. But for me, it just made sense to switch. And so I feel like taking that approach, if you want to look at it, but don't let a website with people who are anonymous, you know, influence your career and your life. You know, my only request is that you take a critical approach to SDN. You know, look at it, talk to people that you know, look at it as well, and make an informed decision that makes sense for you, your family, and your future.
Yeah, well, and the great news is that now that's not all that's out there because of people like you all putting out more information, and also ASTRO supporting us and putting out more information. Bailey, I know you're on the ARROW Education Committee and have worked really hard on that. So what are some resources, some educational materials that medical students and residents can find?
Yeah, so this is probably my favorite question. So there are a lot of resources available for medical students. I know the pandemic was rough and medical students weren't able to do their away rotations, but out of that, we now have ROVR, which is Radiation Oncology Virtual Education Rotations, which is a terrific resource. We also have ROVR 2.0 now that's available for residents, and I've tuned in for a few of those, and I love them a lot. There is also an introduction to radiation oncology slide deck that's on ASTRO's website. That's very helpful and available to all medical students. I know when new residents start, the learning curve is very steep. And ROCSIG has put together IROC, which is an introduction to radiation oncology curriculum for new residents. And we have even had some of our medical students tune in for that as well, and they've found it helpful. More resources for residents. As the ARROW Education Committee, we put together monthly ARROW cases that are disease site specific, that go through epidemiology, workup, treatment of different diseases. We typically have bi-monthly e-contour cases and webinars. The webinars can be Meet Me in Treatment Planning, where an attending goes through treatment planning, looking at DVHs, contours. We also have other clinical webinars that we put together. And then, as I alluded to earlier, we have other resources and high yield webinars for physics and rad bio board prep. And that's not even the comprehensive list. Those are just some of my favorites.
Yeah, that's just off the top of your head. It's awesome. It just really helps, and putting it all together is great too. So we'll go to the next slide. ASTRO has also assembled a dedicated section for medical students, which is new and allows you to learn more about the field. It's right there on the ASTRO homepage, just astro.org. And there you can find video interviews with practicing radiation oncologists. So get right to the source. You can find some journal collections with articles and studies related to the field, and ones that are specifically of interest to medical students. There's some podcast interviews, including one that I did with Inside the Match that was a lot of fun, and I hope you'll listen to it. Next slide. There's also a new set of narrated presentations to give you more information about the field. These are done by Dr. Malcolm Matz and are just awesome. The first presentation is an introduction to radiation oncology and how it's incorporated into multidisciplinary cancer care. And then the second discusses radiation oncology as a career, including pros and cons, talks about the competitiveness of the field, the future of radiation therapy, as well as the current job market if you want more info. The presentation also discusses the need to increase diversity within our field and how radiation oncologists can help to address health disparities locally, nationally, and internationally. There's so many opportunities. Next slide. So I would definitely encourage you, if you're even interested at all, to become a member of ASTRO. Membership for students is completely free and gives you access to all of this information, as well as a weekly email called the Astrogram. You get quarterly news through Astro News, and you can get a reduced rate to our main journal, scientific journal, the Red Journal. Next slide. So ASTRO is also really committed to diversity, equity, and inclusion. It's one of our core principles. It's had a long-term committee that focuses on diversity, health, equity, and inclusion. And the society, as well as the whole field of radiation oncology, is committed there. Medical students are the future. And as such, we're always looking for ways to provide inclusive programs and products. So there's a, here's just a showcase of some of the webinars that were held last year in the ASTRO DEI in RadOnc series. And then another major opportunity is the ASTRO Minority Summer Fellowship Award. And this is for medical students from backgrounds that are underrepresented in medicine. And it's for all years in medical school, preference to first and second years. And it's a fellowship where you get exposed to clinical, basic, and translational research. So ASTRO is currently accepting applications for this up until February 11th. So hopefully you have time to look at that for the summer fellowship. I would definitely encourage you to go to ASTRO's website and learn more about all of these opportunities. Next slide. And finally, I want to thank our fantastic panelists for sharing their personal experiences today. As you can see on this slide, we are all active on Twitter, and it's a really great place. I think on Twitter, I'm only friends with radiation oncologists. And so that's really like all my scroll shows. It's a really great place to meet people virtually. You can send private messages. It's always great to hear from students that are interested. It's a good place to set up mentorship and also to stay current in our specialty. So please reach out to us, and any of us would be more than happy to chat. So thank you again for joining us, taking your time, and look for another resident roundtable coming up in the weeks ahead. Thank you.